Welcome to the TelePals training program sponsored by Seniors in Service. TelePals is a telephone reassurance program designed to fight isolation and loneliness in our senior community. Now more than ever, our frail seniors are more isolated than any other time in recent history. But we have a proven solution, TelePals. Hi, my name is Chris, and I will be your TelePals training host today. In this first training, you will learn best practices on how to have a successful telephone reassurance call. You're going to learn the do's and don'ts of proper senior telephone etiquette, understand the highlights of COVID-19, what to do in an emergency, and of course how to reassure a frail senior in these difficult times. This training is an abbreviated training, and Seniors in Service will provide additional resources and training in the days ahead. We're excited to see the impact that you are going to make in our seniors. You are the key to helping isolated people stay connected right now, and we thank you. You know, according to a recent study, loneliness in older adults results in a higher risk of premature physical decline than does obesity or even smoking. How much greater is that reality today? Our seniors need you right now, and we are so grateful that you have stepped up for the occasion to serve. This training will equip you to be geared up to serve and bring hope and friendship to our seniors. Because of you, we can fight this decline one person at a time. All it takes is a telephone call right from the comforts of your home for less than an hour a week. Thank you so much for your service. Are you ready to be a telepal? Being a telepal simply means that you are a trusted friend. All you need to do is share and connect over the phone. Ask tactful, considerate questions. Speak cheerfully and positively about daily life and shared interest. Be encouraging, be patient, slow, and speak clearly. And be a good listener to draw something out of someone who is lonely and scared. And of course, always be kind and gentle. Being a successful telepal, it requires that you understand the do's and don'ts of proper phone etiquette. It has been our experience that those who practice these simple guidelines have a much higher rate of success. So let's take a quick review. Be a good listener. Show concern and care. Be consistent and dependable. Make sure you set boundaries and calling time frames. Accept the client as he or she is, not as you would wish him or her to be. Use active listening. Of course, use Seniors in Service as a resource for consultation and support. And realize and embrace that you are not alone. Now let's take a look at the don'ts. It is important that we protect our clients and our telepals. Please practice the following guidelines for everyone's safety. Let's review. Don't give your home address to the client. Don't get involved in their family conflicts or take sides. Please don't diagnose a client's situation regarding any health issue. Don't share or recommend medications or dietary supplements, etc. Remember, this is about them, so don't share your problems with the client. Certainly do not be involved in the client's finances. Don't tell them what to do or make decisions for them. We live in unprecedented times, and your client will be concerned about COVID-19 virus. Please remember to remind him or her to practice the CDC guidelines. Be patient and reassuring, and encourage them to seek medical advice from trusted resources. It is unlikely that an emergency will happen while you're on the phone, but it's good to be prepared just in case. Just be aware. Note changes. There are two basic elements for response in a medical emergency: suddenness and severity. Suddenness, obviously, is when symptom can be clearly defined. Because of your regular contact, you'll know when a symptom is out of the ordinary. and severity can be difficult to determine over the phone. So here are some examples of emergencies requiring a 911 call. Chest pains, inability to catch one's breath, sudden onset of a severe pain, inability to move limbs or to speak properly, severe bleeding from any part of the body, loss of consciousness, suicidal attempts or threats to suicide, falls resulting in severe pain, an inability to walk, or a head injury. And please remember, do not attempt to be a medical expert. We just want to say you are doing something important. The time you're spending with someone over the phone can help them stay calm and reassured. Thank you so much. This concludes the training module on best practices on how to care for yourself and how to care for your teleclient. Stay tuned for more TelePals training modules to share even more about how to cope with stress during COVID-19 and on how to be an effective telepal. We are so happy you are here. Thank you for attending this TelePals training program sponsored by Seniors in Service. In this training, you have reviewed best practices on how to have a successful telephone reassurance call, the do's and don'ts of proper senior telephone etiquette, better understanding of the highlights of the COVID-19, what to do in an emergency, and how to reassure a frail senior in these difficult times. You are ready and geared up to serve. Please click here the link to acknowledge you've watched this training and you'll be connected to your teleclient.